Okay, at this point, we have concluded all the statutory responsibilities of REMSCO regarding the CONs and transfer of needs, and we will now proceed to our ordinary report of standing committees, and there is no further need to transcribe the rest of the session. And I'm on video anyway, so if I lie, they'll catch me that way.
Yeah. Since we're on video, we don't need this to know.
Okay. So we now move to the staff report, emergency preparedness update. Scott. Where are you?
Not me.
Scott Chang?
Not you.
The other Scott.
Scott, please come up and speak loudly so we can hear you.
Come on.
Don't you want to be on television too?
Not really.
Not really. On YouTube.
Oh yeah, it's on YouTube, so gotta dance.
12 people.
So the REMSCO is currently participating in the surgery exercise.
It's important.
And, the exercise is it's going to take place sometimes in Q1 of next year.
Why don't you just say your closing statement for the stenographer?
I did.
Oh, you said it already? Where were you?
That's why he's closing
I
up.
just wanted to make sure. My bad. Don't write that down.
Don't listen to Scott.
on the video.
He's over time.
I'm done.
Go ahead.
Just strike Scott from the record.
That's it. Are there any questions
For
for Scott for the emergency preparedness update?
Not me.
Can I ask you a question? Who is involved in this exercise?
It's who's involved?
Yes.
The hospitals, commercial ambulances, and nursing homes.
And
as
that's
well
it?
as in New York City DOH and NYC. So
Is Fidney involved?
Whitney
Is this
is,
the surge?
yes,
No, we are not.
they're not physically involved, but they're aware of it.
Aware is fine.
Yes.
So they're not aware, and therefore the volunteers are not
Volunteers.
either. Okay. As long as Fidney's not done.
This
Volunteers
is
cannot
the
aware.
surge preparedness or the transportation?
This is the surge.
Yeah.
Surgery.
So it's hospital-based.
Okay.
Yeah, it's hospital-based and
Thank you.
there really is nothing for
Wanted to
FDNY.
make sure that the volunteers aren't left out. I want to make sure that Fidney was not left out.
Thank you.
Thank
No,
you.
but
We appreciate
REMSCO
it.
is
I
always
know.
there to support
Huh?
all sectors, so there you go.
Okay, thank you.
Thank you, sir.
Thank you. Program agency update, Marie. That's you.
I forgot.
Forget who you are.
We had our program agency conference call on Thursday, November 6th. It was a short meeting. Every quarter we send information up to the State Department of Health, either the program agency or regional council. And the tool that we use is 86 pages long, and it's redundant, and it's really lovely to work on. We're streamlining it and revising it, and hopefully it won't be so difficult to fill out all the time. With regards to vital signs, anyone that attended, if you're waiting for your certificates, you should be getting them in 4 to 6 weeks. I did not go because I don't go to Buffalo. For trauma, non-trauma hospitals are now required to submit data to the trauma registry whenever a trauma patient is transported to this hospital. That's been data that's been missing for a while, where the trauma patients that go to non-trauma hospitals. It was always in the regs, but now the Department of Health is going to attempt to enforce it, and they sent out Dear Administrator letters to all the hospitals. And this was communicated to the RTAC, and hopefully that data will be sent to the trauma registry. For the BLS protocol update, which nobody wants to hear about anymore, right, Dr. Schenker?
What?
Once we decide to do protocol update, or if we don't, other regions can actually run reports on who is taking the course in their regions. We'll be able to do that also because the state now has an LMS that we can use, and we'll be able to collect data. Aside from program agency report.
Can we host classes on that LMS?
Yes, actually, the Department of Health will allow us, not all the time, if we have something major to put up or things that we want to share, they'll let us put it on the LMS.
Thank you.
We're not the only region that wants an extension for this protocol update. So any region who wants an extension has to, for the implementation of BLS protocols.
Yeah, I just have a question.
Oh,
After you report.
okay.
I would want the REMAC to report on the advisory that we sent out so that everyone is clear on
I have more information.
So just,
Okay, you know what, then, I was just told, any region that is asking for an extension has to submit a plan of completion. You can't just say, give me an extension. They want to know, give me an extension, it will be done by March. And we've already asked to be exempted at this point, and Dr. Schenker will tell you more about that. But agencies will be receiving deficiency notices if their staff is not trained. Hopefully not in New York City yet. And that's my report.
thank you very much. Are there any questions for Marie? We now move to the Training and Education Committee report, more or less.
You want me to go first, or you want to address the protocol?
No, he's next.
Okay,
He can wait.
so I'm gonna take the protocol update off my list, because that was the first thing on my list. So, Training and Ed met on November 15th. We continue to have some obstacles with setting up instructor courses. It's nearing the end of this year, and we'd like to set up instructor level classes, both CLI, CIC, and instructor update classes for the entire next year. But we still need approval from the DOH on our course outlines. So we're gonna make another attempt to get a response on that so we can try and push this through and actually go ahead with our regional plans over here. In terms of a regional training plan, separate from instructor courses, we're gonna be setting up a tag to work with the QA committee to develop a regional educational needs survey to be able to come up with that plan. This is not regarding course sponsors per se, it's more for agencies. As I'm sure everybody's aware that enrollment in classes is down. Recruiting, I believe, is starting to become challenging for folks. So we're gonna be looking to find some regional solutions once we can identify some information, some usable data there. And we're gonna reach out to course sponsors as well. We're still looking to have a symposium, hopefully over the summer. So anybody that has experience with these things, we're looking for volunteers to help us out. I'll have more to report on that next time around, but we're starting to look for speakers and all that, but we still need to figure out venue things, that are a little bit out of my scope, to be honest. Paramedic hospital clinicals is something I'm gonna be bringing up at REMAC. It's come up that, and I sit on the advisory boards for the paramedic programs, and it's very clear that clinical rotations outside of ambulance are becoming more and more challenging. They've been challenging for some time, and they're now really starting to get to desperate points with specific types of these clinical rotations. So we're going to be mentioning this at REMAC and asking REMAC physicians if they can help us out at some of the hospitals, perhaps, that they're affiliated with. That's the end of my report.
Are there any questions for
I
Maureen?
do have a question.
Yes.
Why are instructor course outlines being rejected by the State Department of Health?
They're not rejected, they're just not approved.
Okay, then why are they not approved?
I would love for an answer to that question.
I think that.
That would be great. If I had the answer to that question, we'd be set for our next year schedule.
Waiting for response. They haven't
Oh, you mean no
Oh.
one's responded?
Yes.
Oh.
I was trying to
that-
be
there
nice,
you
which
go. Got it.
doesn't work. You did, it usually gets more attention.
Thank you.
I'll be more blunt next time. Despite Marie's multiple efforts.
Oh, that's okay, I'm not polite either.
And that's why we love
Oh,
Okay. Who's next?
And we're moving on.
Yes, but they don't, excuse me for 1 minute. I'm just doing my TV interview.
okay.
So has his makeup ready? Sorry, turn that off.
It's already broken.
I was kidding.
I know, right?
That's from those, yes. It's a recording.
Dr. Schenker, can you please give the REMAC? Sure, I'd love to. Okay,
Let me make it very clear, I'm not a member of Hatzalah.
so the REMAC met on November 19th, and here's what we talked about. We'll be having 2 additional meetings in December, on the 3rd and on the 10th, to complete the process of going through our unified protocols. For those of you who are not aware, the region has decided to produce unified protocols, which include CFR, BLS, and ALS. There's slight variances from the state, and that's why we're going through this line by line. They need to be submitted to the state no later than December 20th. We should have it in sooner than that. There will be a REMAC tag to review the OLMC physician's course and the process by which they get credentialed. The REMAC Executive Committee was empowered to finalize the protocols because our next REMAC, full REMAC meeting is after the date that they have to be submitted to the state. We had some data from the Quality Improvement Committee about the stroke program, which I will report when I do that report. And the bylaws tag for REMAC will be meeting again in December. Since this meeting, and I just want to kind of bring this up because I just got an email from Ryan Greenberg at 4:40 today stating that the Bureau of EMS will, any agency that cannot comply with the December 31st, 2019 deadline will need to complete a waiver application. This will be an online application that will be posted to the department's website, and there'll be invites for it in December sent out via email. The important thing for some of the agencies in our region is, and this might have to be discussed further between that agency or those agencies and the state, is that no extension will be granted for longer than 120 days after the December 31st, 2019 deadline. If you apply for a wager, like Marie said, you will need to submit a plan, an implementation deadline, and so on. But this is what I just received from the state about an hour and a half ago, or 2 hours ago at this point. So just so everybody's aware, the implementation deadline is the 31st. You can request an extension up to 120 days with a plan of correction.
Can you just tell everyone here what the advisory that was sent out yesterday?
Well, the advisory that was sent out yesterday is no longer 100% current because of what we're saying, because of this email from Ryan Greenberg.
Okay, so then.
So basically what the advisory said was that the state wants you to update your protocols, BLS, by December 31st. However, the REMAC will be sending a letter to the state stating this. The REMAC will not be going forward with the new protocols until after the vote on the unified protocols, which will be on January 19th. That said, this is an agency level decision. If your agency is completely up to date with the protocol update, you can submit that you're completely up to date with the protocol update. If you will not be up to date, if you want to wait until after the vote, if you want to make another decision at any point, you need to submit on an agency level to the state your plan of implementation and your timeline.
I would ask that immediately, meaning tomorrow, a follow-up advisory be sent to every agency in the city outlining what you just said, because it's very unclear to some little BLS squad somewhere that has a CON of 5 blocks, whether they have to use the new BLS protocols or they can rely on you.
Okay.
So I know what you just said.
The answer to that part, just to make it clear, is as a region, we've always operated under the same protocols. It's a very big challenge to us that the state is telling agencies, the small little agency, that they have to update to the new protocols. There will be some confusion initially. The REMAC still states that we are submitting unified protocols to the state for the January 19th meeting. We hope that they get approved, and if they do, in the region, you will have to train on the new protocols regardless of if you've updated or not. I leave it up to agencies, because the state does, to determine if you want to train once and then again or not.
So the agencies don't know what the phone call you just had with Ryan Green.
Correct, it's an email,
So that
it's in writing.
should be sent out. To
I was waiting for it in writing,
Great,
correct.
Thank you.
I get some
Yes.
clarification, Dr. Schenker, so,
Point of clarification.
thank you. So Director Greenberg sent out a directive that says that you may apply for a 120-day extension.
Correct.
Which means that you still have to do it,
Well, no.
the state's training.
So right now, today, you must be done by December 31st.
Correct.
If your agency is not complying with that, you can submit a letter, an application to the state for an extension up to 120 days.
Right.
That you will need to have a plan in place for when you will complete the implementation.
Understood.
That's it.
That said, that still does not absolve you from doing the state's training which is going to cause more confusion when we have to implement ours simultaneously here in the region.
I agree with you. I am not
So-
denying that
but-
that's the
but
case,
the
and I
other
made that
point is, I
argument.
think we need to be clear to the agencies then that they still need to do the Department of Health training regardless of whether it's now, 120 days from now, they're still gonna have to do it.
Well, again, what I can't speak for is what will happen after December, I'm sorry, after January 19th.
I hear that, but the point with once the protocols here are approved, the regional ones, we're still gonna have to do both sets of training.
That's, I don't know. That's, the answer to that
Well,
is
that's what he's saying,
Might
120
turn them
days.
down completely and tell us to go home.
So I think we should make a recommendation to agencies that they abide by the state's directive and get their state training done, because there are a lot of agencies that are not.
That recommendation.
Like,
well,
And this is a REMSCO, not a REMAC, and I don't know what to tell you, but it's REMAC versus CMAC.
I hear you, I'm addressing the REMAC chair, and I'm saying that I think it would be beneficial here, so that there's less confusion at the agency level and at the provider level.
I
That
think
it
that
is
there will
made
be
clear
more
that people are
confusion.
still required to do the
I
state's
think what you're
training.
talking about will lead to more confusion,
I don't
because,
think we have a choice. You just gave you a 120-day extension,
well,
which means
again,
you still have to do it in 120 days.
120 days from December 31st, at which point there'll be new protocols, and hopefully they will be
120
passed.
days to submit a plan.
To submit a plan, but you still
No.
have to
The
do their
plan
training.
has to be submitted before December 31st. You have 120 days from December 31st to implement it.
And let's say my plan is that I'm not gonna do it till June.
Well, then you'll be past the window.
Yes,
Dr. Schenker, maybe make a suggestion that the agencies use our plan, the regional plan, to implement these protocols in January as part of their plan. So basically them saying, you know, we're requesting an extension based on the fact that the region has not approved protocols yet, and we're awaiting that approval. Do you think that that would be satisfactory as to our agency plan?
Again, I've had the answer, meaning if your agency submits to the state,
Yeah.
saying we are waiting for New York City to come up with to get approval or denied.
Correct.
At that point, we will start our training and we'll have X amount of days to complete.
Correct.
That would be appropriate.
Correct.
My concern has always been having different standards in the region. So if you have people operating under the new protocols, you have people operating under the current ones because they're pending the REMAC unified protocols being approved, that's two standards. I mentioned this to Mr. Greenberg, I mentioned this to the state, that was my concern. That they don't seem to, they do not seem to agree.
Nancy.
With all due respect to Mr. Greenberg, the Regional Council in New York City takes care of the needs of New York City. The state suggests guidelines. The REMAC determines what protocols get done here and get implemented here. It would be in the best interest of this region for the Regional Council to support the suggestion that our protocols, which will be completed by January, be the group of protocols under which our EMS system operate. It is unnecessary and foolish for us to move in any other direction. We are dealing with millions of people every day, and we cannot abide by a foolish deadline when it can create chaos in our city. And we need to make that very clear, and I believe that we need to state that very specifically.
Nancy,
Yes,
would you like to make a formal motion?
I just did. That's
I didn't
my
hear a
full
motion.
I
I move that,
motion.
I move that what? That we write the REMSCO, write a letter
To the state, to the Department of Health stating that our protocols will be completed by mid-January, at which time our agencies will then comply with protocols, but we are going to function as one system.
and that's a good thing, and follow up on that, what's going to happen if the state says the protocols you submit mid-January are unacceptable, and you must use our protocols. And they have the right to do that.
Okay, let's hit
So-
that one when we get there.
Okay,
Right
so then
now,
we
we
have a
need to
second to that
support who
motion?
we are.
Second,
You have a second. Okay, you can put together some letter
I would
send it to me and I'll
like
sign
to
it.
make
an amendment to the motion?
I don't want to make a formal amendment. I would just like to know if Nancy wouldn't mind making an informal amendment to her motion to add that this be a joint REMAC REMSCO letter.
Absolutely, I
Would that be
agree.
okay,
It would
Mr.
be okay
Chairman?
with me, but are you speaking on behalf of REMAC?
I am speaking on behalf of REMAC.
Okay, and we have executive committee, you have the authority to speak on behalf of REMAC?
Yes.
Okay, then by all means, make the REMSCO on
Skip back to the full motion.
Okay.
Excellent. A little bit out of order, and I'm glad that they're not recording what we
Who
just
was out
said.
of order?
Yes, they are.
Yeah,
Recording, who was out of order?
that's you two, what?
Where was there out of order? Call the question.
Do you have the executive
Yeah,
committee?
let's go.
Question was
Well, the
called.
executive
Anyway,
committee has made this determination. This was
Moving
written
on.
before this.
Any
meeting.
further discussion?
Next.
All in favor, say aye. Aye. Anyone opposed? Any abstentions? Please mark it as being unanimous. The unanimous view of REMSCO and the singular view of. Okay. Dr. Shanker, do you have anything further to say?
I do. The only thing else I want to say is that this is an opinion that is not my own. It is from the executive committee, and we've discussed this prior to this meeting.
Thank you. So now you can make it unanimous in the executive committee as well.
Thank you.
Well, Mr. Chairman, the executive committee was authorized by the full REMAC to speak on its behalf. So it actually comes from the full.
Excellent. Okay, so it comes to
Thank
full
you.
REMAC.
Thank you,
I'm sorry I wasn't at the last REMAC meeting. I was in a car in Midtown Manhattan. I was there for 2.5 hours. My waist told me
This
so
meeting is
another
going
hour
to
to
take 2.5
go.
hours if you keep
I
talking.
let it take 5 hours. I was 5 hours in my car today. I don't know what was going on.
Please make sure that's the record.
You know I try to come. Okay, Dr. Redletter is not here, but I believe Dr. Schenker will give the Quality Improvement Committee report.
I will highlight the key points. The QA committee met via conference call on October 17th. There was review of some of the data elements for the stroke project and the First Watch project that's going on. Similar, also there was a discussion of the ET3 application. 11 applications were submitted under the FDNY parent application, which accounts for approximately 90% of the EMS units in New York, of the EMS 911 units in New York City. Sorry, QA will be the focus of that of the next step of the project. Okay. Some quality data from the LVO project was discussed. There was 580 patients that were approved to go to a thrombectomy center. 77 of those patients were diagnosed with a stroke, meaning a ischemic stroke. 189 were diagnosed with a LVO, and this is in line with national studies. We had a 33% diagnosis sensitivity for LVO in this group, which is consistent with other studies so far. And that concludes the QA report.
Are there any questions for Dr. Schenker regarding the QA report? Let me quickly report on you. I know the hour is late on the last REMSCO CMAC meeting, which occurred on September 24th and 25th. This is the summary. The good news, New York City hashtag protocols were approved. New York City Appendix O tension pneumothorax was approved. New York City rescue medic protocols was approved. New York City Maimonides Medical Center ketamine demonstration project must be resubmitted with requested revisions. There was a general approval on the general state BLS protocols regarding ibuprofen dosage for pediatrics and pregnant patients. And there was a very important acceptance of Part 800 revision. Most people didn't pick up on this, but Part 800 has a long shopping list that they carry around with you. You got to check off everything. What this revision basically says, that there's no more list, and that the Department of Health can basically create this essentially on their own without having a mandatory list of each item that goes along, which is a good thing because it makes it a little bit more flexible, and you don't have to count 4 safety pins and 3 of that, and it makes much more sense, so it'll streamline things. Now, there's a whole section here on New York City Unified Protocols. So Dr. Schenker, I must say, I must give him credit. He faced an extremely hostile audience, and he represented us much better than I would have. I would have lost my temper long before, because there were hostile remarks addressed by members, okay, all around the place, and it was clear that the state felt that it was, number one, time for us to accept the state BLS protocols, and the fact that we're not was shameful because they had passed it around to all the regions 3 years ago, and there wasn't a single comment from New York City about it. And I know that happened because I asked Marie 3 times to send them out to all the members, and I said it's going to happen, and we didn't do it. The other thing is, the feeling is by many physicians, not most of the physicians from New York City, although there are a few in New York City, that it's about time there's only a single ALS protocol statewide. We are at this point the only holdout from all the other regions, possibly for very good reasons. I don't, again, as chair, I'm not going to offer my opinion, okay, but there was significant statements made that it's time New York City joined with the rest of the state. I know that Greenberg wants this to happen. Other physicians definitely want to happen. And there was basically a feeling that we, and I got the feeling sitting around the table, that people were attacking New York City for whatever reason. Okay, whether it's that they think that that New York City people are all crazy, and we think anyone on the other side of the Hudson River is a foreign country. Okay, whatever the cultural, can I use the word cultural right now? Whatever the cultural reason is, there's a lot of resistance to New York City doing its own thing, even though Dr. Schenker made a great case. For example, we made the case that for the fire department, they have to retrain so many people, it would cost them $10 million or some other big number to do it, and it just will take time. And some yacht sitting on the side to me said, why? Let the members do like everyone else around the city, the state does, and do it at home, off work, right? Do it on their own time. Why is they paying so much money? So I turned around and said, yeah, but you know, we have a union. You guys don't. Okay? No. So they don't care. They don't understand. Frankly, they really don't understand New York City. It's really the feeling that I'm getting. Now, I am not very hopeful that this is going to change, because there's a significant number of doctors, and our physicians are in the minority, and Dr. Schenker did a wonderful job. I say this again and again publicly. Okay?
Can I get around to closing Dr.
But there was a lot of opposition. So I know that the REMAC is working extremely hard to get a new set of protocols up there. And I wish I could say that in January it will be approved and you won't get it thrown right back in your face. I will not be there. I'll be in another country during January, so I leave it to Dr. Krupe. I'm a coward, yes.
There's nothing.
I'll be in another country across the Atlantic, not across. Dr. Krupe will be there.
Long Island.
And not even all of our own physicians are backing us up. You should know that. Not even all the physicians in REMAC feel that REMAC should continue to fight this issue, without mentioning names. Okay? So I think it's an uphill battle. Dr. Schenker thinks that he can still do the good fight, and I hope he does. Okay.
So just one thing to clarify.
Yeah.
The ALS protocols and the collaborative is not on the table in this January meeting. It's not something we're talking about, and they're not pressuring us with the upgrade, with the updates. We are not joining the collaborative. That's not what we're talking about right now. The state has released BLS protocols, which they believe to be the minimal standard. We have adapted those, and as we add them to our unified protocols, we found things that we felt were maybe not a minimal standard, but above a minimal standard, and that is what we're really arguing. The protocols, for those of you who've looked at them, the BLS protocols from the state are written as more of a guideline than the much stricter version that we have in our region. And that has to do with the fact that the quality assurance in our region can't be maintained with a more liberal guideline just due to the volume of our system. So you're talking with a system that sees on the 911 side 5,000 calls a day, plus if you add the transport side, you're up to approximately 7,000 calls a day, ambulance transports a day, that we need to have a single set of protocols, and obviously we can't do quality assurance on somebody who's gonna consider something, may do something, should do something. It makes it very complicated.